Hello everyone, my name is Solomon Steven. I'm a registered nurse and welcome back to my YouTube channel. On this channel, I simplify nursing topics to help nursing students understand them easily without confusion or cramming. If you have ever been asked to write a nursing care plan and you just sat there thinking, which nursing diagnosis should I even use? This video is for you. Today I'll be explaining common nursing diagnoses every nursing student must know. These diagnoses appear very often in exams, care plans, clinical postings, and once you understand them, writing care plans might become very easier. A quick reminder from our last video: a nursing diagnosis focuses on the patient's response to illness, not the disease itself. So nurses don't write malaria or hypertension, they write how the patient is affected. I'll be explaining some very common ones in a very simple way. Number one on our list today is acute pain. Acute pain means pain that started suddenly or recently. You will likely see this diagnosis in post-operative patients, in injury cases, in infections. And if the patient complains of pain, acute pain is usually one of the first nursing diagnoses to consider. Number two, we have risk for infection. This diagnosis means the patient may develop an infection even if there is none yet. It's likely common in surgical patients, patients with wounds, patients with catheter or IV lines. And always remember, risk for means the problem has not happened yet. Third on our list today, we have hyperthermia. Hyperthermia simply means elevated body temperature. You always see this in malaria or other infections too, or during heat exposure. So whenever a patient has fever, hyperthermia is a very common nursing diagnosis. Number four today, we have impaired gas exchange. This is actually when the patient has difficulty breathing or oxygenating properly, and is definitely mostly common in asthma, pneumonia, COPD. And the signs include shortness of breath, low oxygen saturation, and cyanosis. Number five, we have deficient fluid level. This means the patient has less fluid in the body than required. You see this in vomiting, diarrhea, poor fluid intake, and their signs include dry mouth, reduced urine output, and weakness. For number six, we have impaired physical mobility. This diagnosis is used when the patient has difficulty moving or walking, and is common in stroke patients, fractures, elderly patients. And mobility is very important because it affects recovery and independence. And last on our list today, we have anxiety. Anxiety is a very common nursing diagnosis. Patients may feel anxious due to illness, the hospital admission, or even surgery itself. And the signs for you to recognize anxiety includes restlessness, fear, increased heart rate. So in exams, always support your nursing diagnosis with assessment findings. Never write medical diagnosis when nursing diagnosis is required. Always ask yourself, how is the condition affecting the patient? So in summary, common nursing diagnoses every student must know include acute pain, risk for infection, hyperthermia, impaired gas exchange, deficient fluid volume, impaired physical mobility, and anxiety. This diagnosis will help you in exams and clinical practice. So if you found this video helpful, please like, subscribe, and share with your fellow nursing students. Thank you for watching. I'll see you in the next video.